Alright, so welcome to episode 3 of the Cognitive Behavioral Therapy for Insomnia Skills series, where each video I talk about a specific strategy that we as sleep clinicians commonly employ in our work with people with insomnia that are non pharmacological. So they're behavioral and cognitive strategies meant to help you get out of the insomnia trap and get you back on track. So in this video, I'm going to talk about one of the strategies I find particularly helpful with patients who struggle with a lot of worries, especially during the nighttime. If you don't know me, hi, my name is Dr. Parky. I'm a clinical psychologist and behavioral sleep medicine specialist. So let's get into the video. Today we're going to be talking about worry time. So fundamentally, worry time is a pretty simple technique where essentially we're saying, hey, like we're noticing you doing a lot of worries at night when you should be sleeping. So can we move it a little bit earlier in the evening so that you're doing the processing and the problem solving earlier in the night and your brain gets to say, hey, like I've already done all my worrying, so I don't need to do that at night anymore. So worries can be largely broken down into either productive worries or hypothetical worries. Productive worries are the worries where there's kind of a problem to be solved, like, I need to make sure that my kids have a babysitter tomorrow because I'm going on a date with my spouse. That's something that needs to be addressed. Whereas a more hypothetical worry might be like, what if I in the future don't have enough money and I won't be able to live a really nice life in retirement? That's a bit of a trickier thing that you can't really resolve, at least in the moment. Or you might be worried, what if my 2-year-old might not get into the college that they really want to go to? Again, like kind of a hypothetical worry. And you can address these two different types of worries differently as part of the worry time. So for worry time, you would pick a time that works well for you to be able to sit down and take out a journal or Word document and put down your worries. So typically what I find usually helpful is to do it just before dinner or just after dinner. Usually there's a nice little space where there's 5 or 10 minutes that you can take to write down your worries. So there's two ways that you can go about it. If most of your worries are related to productive worries, like I need to resolve a problem, then you can almost like create a little sheet where you put a little T, and on one side you put the problem that you're worried about and then the solution, or the first step to the solution. So let's say the problem is I need to get a babysitter. So the solution could be I'm going to call my parents, or I'm going to go online and find a babysitter or call somebody and make sure that they can take care of my kid. So you can write down both the problem and the solution. On the other hand, hypothetical worries are things that are a little bit harder to resolve. So here your goal is not to make a solution happen. It's meant to just allow yourself to process. So you can pick a topic that you're bothered about. Let's say it's your relationship or it's about a certain work issue that has no solution. Then you can kind of just sit there for 10 minutes and allow yourself to worry and process. So you can write down how you feel about it, your thoughts, your worst fears. Just give your chance in your brain some time to process so it doesn't have to do that at night. So in terms of when, where, and how much, you should probably do it sometime in the early evening so it gives you some space between the worrying as well as your sleep. Where you should do it, probably not in your bed, in your bedroom environment, so that again, it's separated from that time so that your bedroom isn't associated with the worrying. And how much? I would say as much as you can, so maybe at least a few times over the week so that you get a really good sense of whether this strategy can be helpful for you. So worry time is going to be really, really helpful if you notice that these types of worries are kind of your main issue when it comes to being able to fall asleep at night. If your worries are a bit more kind of sleep anxious focused or more ruminative focused, then we'll talk about different strategies down the road in this series about how you can manage these different types of thoughts. Thanks for watching as always, and I'll see you in the next one. Bye-bye.